patients coming in like her who are on a lot of medications and they're sick, oftentimes the doctors may be afraid to start to remove medication. Well, the patient's sick, so we can't stop the medication. Well, actually, part of the reason the patient's sick may be because of some of the medication. So the long list of medications have to be listed as part, at least from our philosophy, it has to be listed as part of the problem. And it doesn't mean we just stop them all willy-nilly, but we have to say, okay, you're on a lot of medication, so we need to address this as well as we address the heart failure, as well as address the kidney failure, et cetera. Hello, everyone, and welcome to Montgomery Heart Wellness. We have another episode of Clinical Rounds at MHW. And the patient we're going to discuss today is an 82-year-old lady who had suffered 3 heart attacks, if I remember correctly, and had heart failure and some early kidney failure. We saw her after her cardiologist had given up on her. So, Camille, what can you tell the audience about this patient?
So when we saw her, she had actually just been hospitalized recently for worsening heart failure. So even though she had a stent for her last heart attack, she was still getting worse. You know, her heart was pumping at 30%. She had a lot of fluid around her left lung, around her heart, and her kidneys were really suffering as well due to poor cardiac output. So she came in a wheelchair, very out of breath, having a lot of orthopnea and fluttering and tremors, and just really looked not in good shape.
Wow. And orthopnea is a medical term we use when a patient gets really short of breath and they lay flat. And oftentimes heart failure patients, they're so congested, they're not able to lay flat. And if they try to lay flat, they get acutely short of breath, have to sit up. And so that condition of orthopnea really underscores how bad her heart failure was. And I think she was having to sleep sitting up most of the time. Just kind of as we think through this. So as a patient in her early 80s, she had suffered 3 heart attacks. The 3rd heart attack was more recently. She had a stent placed. She was discharged from the hospital at that time, had to be readmitted shortly after. And she had excess fluid. We call that congestive heart failure or pulmonary edema. Just so we make sure our audience understands, I'm sure people are looking who have medical backgrounds, but when you get congested, you can have fluid buildup inside the lungs in the airways, which is where you have, you breathe in oxygen and take up oxygen. So if you have fluid there, you're not taking up oxygen very well. But you can also have fluid around the lung itself in the chest wall that can sort of put pressure on the lung. And then she had fluid in the airways, she had fluid around the lungs, and then she had fluid around the heart.
Right.
Okay, so she was very congested, and so this made a lot of problems for her. Now, she also had kidney failure. Now it was stage, what?
4.
Stage 4. What do you remember the filtration rate? We have a number, the GFR we measure.
Yeah, initially, I think the lowest it was 16, 17. So she's right on the brink of stage 5, actually.
5, yes. And so people understand there's a number. Many of you may be familiar with the creatinine number, which is the protein we measure in the blood that's filtered, and the higher that number is, the worse the kidney function. And then that's the number we call the GFR. It stands for glomerular filtration rate. But GFR is just the filtering rate that your kidney, how well or fast it filters the blood, is the way of thinking about that. And so when that filtration rate, which normally should be above 60, ideally above 90, but at least if it's above 60, it's pretty decent. But if that filtration rate number goes down to below 15 and it stays there, then typically a kidney specialist would do what we call declare you at end stage and start you on dialysis. So she was at 16. So she was just above the point where she needed dialysis. And she had a weak heart in addition to that. Now she was also on an infusion pump, and she was getting a medication called milrinone. if I remember correctly.
Correct.
And milrinone is a medication that is designed to cause the heart to squeeze, sort of like flogging the heart. So she was getting that kind of assistance when we saw her. So I don't know, what are your thoughts on, a patient in this condition?
We have to really follow her and watch her very closely and have a lot of work to do to get her in better health and better shape, and there's not really any room for a deviation from what we recommend.
Basically, she comes in, so had been hospitalized. How many medications was she taking roughly?
Oh, in the beginning, a lot, probably at least 5 to 8. I can't remember.
5 medications. And one thing I want to underscore with our audience, and this is something that we take very seriously here, is that frequently individuals with multiple medical problems. So she clearly had kidney disease, heart disease, and there were some other issues we're not emphasizing here, some arthritic issues and things like that. Oftentimes people in the hospital, they're given proton pump inhibitors, which oftentimes are left on them. It can get you to a point where you rely on them. So she's on multiple medications, and the problem with multiple medications is that they all have some adverse events, adverse effects. Now, many adverse effects go unknown, meaning that the patient doesn't feel symptoms. So, for instance, somebody who's on a proton pump inhibitor for reflux or to prevent ulcers if they're in the hospital, but that proton pump inhibitor may prevent them from absorbing magnesium. And so they can have a magnesium depletion. So a magnesium depletion can lead to arrhythmias, poorly controlled blood pressure, anxiety, insomnia. So you have all these other problems that are related to one medication that's not really recognized. And so you have these other medications which you're prescribing yet other medications for. So anyway, so what was your first course of action? So she comes in, we see her, examine her, do our evaluation.
Initially, we did have to give her 1 dose of IV diuretics because of the fluid around the heart, the pleural effusion, but we only gave her 1 intravenous dose, and we're monitoring her kidney function really closely. And then after that, we just got really aggressive with the plant-based diet, the time restriction, and the ozone therapies.
So she started off with a nutritional detox, and that included raw plant foods. And what was the time restriction that she had?
We put her on the 11 to 4. I think she did eat beyond that sometimes. But, her daughter did a great job of making all the food and made it oil-free. Some of her food was not always 100% raw, but it was all whole food, plant-based, oil-free. I thought pretty quickly she was walking better. And if you look at her now, she's walking very fast down the hall. So we went with plant foods. We removed the animal protein, heavily processed foods. And then she started with sauna. We gave her 1 dose of IV diuretics as we needed to. And then we started, how soon did we start making medication adjustments from the standpoint of weaning other medications? We started weaning medications really within the first few weeks because her blood pressure would get low as well because she was on a lot of the standard medications. And we had to cut back pretty quickly, and we did enhance her with some supplements like magnesium and some anti-inflammatory supplements. Then eventually she wasn't even on any oral diuretics, so her leg edema was gone. Listening to her lung exam was better. Every time I talked to her, I'd always ask, so are you coughing when you're lying down still? Are you having trouble breathing? And that would be one way I could see if she was getting better because her symptoms would be less and less frequent. Then in time, we did redo her echo here. We didn't see any pericardial effusion. We didn't see the pleural effusion we had actually seen on the echo a little bit before. And what was this time period? How long did this take? Between February and May, so not very long. So basically, we went from in a 3-month time period.
she went from having a pleural effusion and pericardial effusion, that's fluid around the lungs and fluid around the heart, to having none of that.
Correct.
In 3 months. Okay, excellent. And then during that time, the medications went down by what percentage? By half or?
Oh, probably like 75%.
75% reduction in medication list. And then how was she doing functionally? She was in a wheelchair when she came.
Right.
In that 3-month period of time, what was the progression?
So she would start walking without the wheelchair really quickly, actually, I think.
Probably within the first 2 visits, if I remember correctly.
Yeah.
Yeah.
And then she'd walk kind of holding her daughter's hand, and now she can walk down the hall really more on her own. And functionally, her mood was better too. She would now spend every weekend at the beach getting sunlight. So her quality of life was a lot better, and how she felt physically and mentally too.
Her daughter was saying she was actually able to, climb on the rocks and the beach and things like that. So she was actually very mobile, which, it says a lot because, again, she's in her early 80s. Here's someone who was given up on by her cardiologist. She was on a milrinone pump. She was in a wheelchair. To go from that to be able to walk on unsteady ground, there are a lot of issues regarding gait and stability, etc. So, that's a major improvement in terms of her overall well-being and major steps toward her being independent. Because the flip side of this could very easily have been her in a nursing home, just sort of, wasting away, waiting for her final days to come. Did the pumping function of the heart went up to what?
It went up about 5 to 10%.
Okay.
So it's still much lower than normal, but I mean, she had multiple heart attacks and did have scarring in the heart, so hers might not ever get completely back to normal because of the scar tissue.
And then the kidney function, how did that do?
That really waxed and waned over time, and really, I think the highest her GFR filtration rate went up to was 20, but, it's more than just the number, too. It's just about her functional status, her symptoms, and I feel just talking to her, looking at her, and what she's able to do was just a dramatic turnaround.
But we're still not done. She's made great improvements. So we're off the milrinone pump. We are on fewer medications, right? How many meds she's down to?
I believe she just takes the smallest dose of beta blocker.
Okay, very low dose beta blocker, so no more diuretics.
No more
needed,
diuretics.
All that. No more wheelchair. She's more energetic, more mentally clear. And so the therapy, we started off with the nutritional detox, infrared sauna. She did get a dose of intravenous diuretics, but we were able to stop the diuretics shortly after. The other natural therapy included high-dose ozone therapy. Now, for many of you are not familiar with ozone therapy. Ozone is a gas, it's O3, and so it's less stable than oxygen, O2. The way we use it here at Montgomery Heart Wellness, we have equipment that allows us to generate ozone from medical grade oxygen. So we generate ozone gas. The procedure is where we will draw a certain amount of blood from the patient into a sterile bag. We'll then infuse that blood with ozone gas, and so that ozone gas activates within the blood. So it creates liposomes with albumin cells and also activates red cells. So it's reinfused back, activates the immune cells. It's reinfused back into the patient. And in summary, the biological effects consist of improving mitochondrial function, and this is all at the cellular level. So when mitochondria work better, AT production is improved, overall cellular function improved. So your heart cells work better, your endothelial cells work better, so therefore your blood vessels work better. It allows for the production of increased nitric oxide, and it also modulates the immune system. And so by that, someone who has lots of inflammation, it could be inflammation due to a chronic illness related to inflammatory disease or some other kind of inflammatory process. but it will then tone down that inflammation. So by modulating the immune system, it'll tone down an overactive immune system, or it'll rev up a suppressed immune system. So that immune modulation is really important, because oftentimes individuals, in fact, I would argue most individuals have chronic illness related to increased oxidative stress, increased inflammation, which is oftentimes related to immune disarray. And so it sort of puts all that under control, so it decreases inflammation. So many of these benefits that we saw, meaning that the fluid around the lung, which is like an inflammatory process, reversed. The fluid around the heart, which is like an inflammatory process, in part reversed, and her respiratory status improved. So ozone is very powerful in that way, and it's one of the therapies we use that I like to classify as regenerative therapy, along with the nutrition, along with the sauna. In summary, here's a patient in the early 80s, had multiple heart attacks, despite having, multiple medical procedures. Stents are pretty invasive procedures. And she came to see us in dire straits based on her diligence, and she had a very supportive daughter who was very diligent and worked with her. She stuck with the plan. And I want to emphasize that, because the work we do here, we don't have any magic wands. At least I don't know of any. I don't know if you. Really, we make basic recommendations. The patient actually have to put in a lot of work.
Correct.
And so our hats go off to the patient and mother, because they put in the work coming here regularly and things like that. So she did quite well. So there you have it. The patient with heart failure essentially reversed the heart failure enough and reversed the kidney failure enough to have a much more active life. And we're not really done with this patient. I want you to stay tuned. We will give you updates, because there are a number of other therapies that we have that we'll be introducing to her care and we'll also introduce to you. But until next time, you guys take care.